The things that you only see in films, that is your reality. Horrific car crashes, like people with life-changing injuries, had limbs chopped off. Like, you cannot make this stuff up. If you have a friend that's a doctor, go and give them a hug for me, okay? Go and give them a hug for me. Go and give them a big embrace and say thank you and say we see you and I say, I hope you're okay. I hope you're coping in this life. Some of the things that we see are just border on traumatic. Things that happen on a daily basis. It's just a normal day for us. Or a person that does not work in healthcare was to see it, they would be highly traumatized. Yeah, this is why personally I advocate that every doctor should have access to free therapy. I remember one fateful day on a key take, okay? We had 3 cardiac arrests back to back. Listen, you can't even make this stuff up. We had just started a shift, okay? As soon as we get there, we could not even finish handover. Yeah, we did not finish handover. All of our bleeps start going. Cardiac arrest on this ward. So you know what happens. If you work in healthcare, you know what happens with a cardiac arrest. Everyone, basically, whatever you're doing, just drop it. You're running, but you're not supposed to be running, but you're kind of running, okay? To get to that ward as soon as possible, because here is crunch time, okay? Every single second is important, okay? We get to the ward now, and you know, with a cardiac arrest, there's about a good team of about 10 people going there that will be present on site to perform essentially life-saving CPR to save the first patient. We lose the patient, unfortunately. We unfortunately lose the first patient. You don't even have time to recover. You don't have time to breathe. You don't even have time to process what's happened, okay? You're just walking on the way back to A&E because you've got patients to be seen in A&E. All of our bleeds start going off again. All of our bleeds, I'm saying, what is going on today? So now you're going to another ward. You're running, semi-running to get to the next ward. CPR. This one survives. Oh, thank God. 15 minutes later, you're back in A&E now. You're seeing patients, you're getting on with jobs. Bleeds go off again. Cardiac arrests in XYZ ward. And it's just like, when this happens, when you just lose a patient, when somebody's just died, there's no downtime. There's no, sit down, breathe, sit down, process, how are you feeling? Are you all right? Are you able to get on with your day? No, you're back to work. You're straight back to work. Because remember, there's been patients that's been sitting in A&E for 8 hours waiting for someone to see them. So you don't have time to process your traumas. You don't have time to process nothing. I've seen a woman on a C-section table arrest. Her heart stops beating. They're just a fight to save her life. So we're providing her life-saving CPR whilst trying to save the babies. So she was pregnant with twins, trying to deliver the babies and stitch her up to reduce blood loss. Yeah, and CPR going on at the same time. Mother of 4 already, and now there's 2 being added, and she dies. Seeing 16-year-olds. Horrific car crashes, like people with life-changing injuries, people that have attempted suicide, they've had limbs chopped off. Like, you become so, as doctors, I feel personally, you become so desensitized to many things. When we told you about this, you didn't even react. Like, do you even care? Yes, I care, but you have to understand that the things that I see, or the things that I have seen, the adrenaline that I experience, okay, you know when you watch a documentary and it makes you cry a little bit, some doctors, depending on what specialty they work in, they see it every single day. If your partner, your babes, is a doctor, be patient with them, okay? Be patient with them, because we see a lot and they don't usually think about almonds.